Hello, ladies and gentlemen, good evening, good afternoon, wherever you may be, or even good morning, depending on what part of the world you are in. My name is Dr. Edwin Mwinga Chokwe. I'm a mental health specialist, specializing in community mental health activities, and also environmental activities which impact on mental health. I'm based in Mombasa, Ambalala House, Nkuruma Road, first floor, North Tower. Well, today I want us to continue discussing in general terms our world of rhythms, a world of mental health, a world of environment. You will want to know that we are living in a world where the environment impacts on us, and that impact may be negative, it may be positive. Now, delving further, I'd like just to let you know that environment will impact on all of us the moment we are conceived. After conception, that is when the female egg and the sperm fertilize and produce a zygote. There and then we have a living being. That living being has the DNA or all the details of your life, of your future. Just the details of your parents, that is your father and your mother. That DNA carries everything that is good about your family and anything that may be bad about your family in terms of health. So it's important to understand that factors at delivery or even factors at conception are important, as it's equally important as factors after delivery. For example, the inside of the womb, we can call it the environment, internal environment, is subject to external environment. For example, if a mother is exposed to harmful drugs, is exposed to harmful experiences, including fear and trauma, if the mother is exposed to radiation. Now, this question of radiation is quite clear to each one of us, especially after the various nuclear problems that we have had from Japan to Russia. We have had complications because there was a radiation, X-radiation, and that radiation, you did not see it, but it was perceived by the mother, and through the mother, the child. Some of these children are later on born with complications, and you don't know where the complications came. It is because their parents were exposed to radiation. Or toxic drugs. For example, early in the 60s, there was a famous drug which was used for family planning. It was called thalidomide. And suddenly they found that many of the children who were born after that, they had problems. They had no arms, or they have no limbs, a condition that is called amelia. Now they had to trace it back to the drugs that the mother took. What I was trying to say is environment starts immediately after conception. Now, during birth, there could also be complications during birth, or during the conception itself. A mother may have various infections. Okay, the famous infections, we call them torches. These are infections which are passed from mother to child through the placenta. TORCHES stands for toxoplasmosis, CMV virus, rubella, herpes, and now other conditions like syphilis. You know, they may affect the mother, the child through the mother, and any viral infection. And that's why we normally say that the mothers must go to the clinic to have them checked, okay, so that they are given immunization against this virus, because there is no treatment for any virus. What we have is immunization. You can be immunized so the child is born normal. Now during birth also there could be changes during the birth, because you have a complicated birth, especially in Africa and in areas where there's malnutrition amongst the mothers. That malnutrition causes the mother to have a small pelvic outlet. Now when you have a pelvic outlet, then it is very easy for a child to be unable to come out quickly during delivery. And during that delay in delivery, the child may suffer low oxygen levels in the brain. Those low oxygen levels will affect the brain and later on may present as a mental disorder. Okay, sometimes there may be trauma, because the child may fall down, or during assisted delivery, some people use forceps or pull out the child, but in the process they may harm the brain. Now once the brain is harmed, then the child will present with various types of mental conditions, including mental disorder, epileptic, falling, and all kinds of problems. So that is the introduction we wanted. We shall continue in this manner.